Welcome, you are watching Head to Head. I'm Antonina Antosha with UATV. Ukrainian patients and doctors are seeing more benefits from healthcare reform, which officially came into effect in April 2018. This reform aims to bring Ukrainian healthcare closer to Western standards. Its first stage was a new system for family Medicare. So, how successful is this reform so far? To tell us all the details, we welcome to the studio today Pavlo Kovtonyuk. He is a Deputy Minister of Health of Ukraine. Hello and thank you for coming.
Hello.
So let's talk about the reform in general. It began the primary level of healthcare services, the implementation, where the pediatricians, therapists, and family doctors take place. Now, how do they cooperate together within the framework of the reform?
Yes, indeed. We need to implement kind of Western standard healthcare financing system in Ukraine. This is the law on health reform is provisioning, and it takes 3 years to do so. So the first year is already passed, and the plan for the first year was to implement this system at the level of primary care. To tell it more simple, in simple terms, it is the first entry point to the system for a patient, which is your primary care doctor, your family physician, your pediatrician, or in Ukraine also we have some therapists, or it's in Western countries it's called internal medicine physicians. So at this level we implemented completely new rules.
Has it simplified the healthcare issue for Ukrainians?
Yes, of course.
Because I've heard that a lot of people are confused, and even though they have signed the contract with the family doctor, unfortunately, they can't reach the doctor over the phone or cannot get the doctor to come and examine the patient at home. How is that regulated?
It's difficult to change everything we have not so good in our system overnight, right? So, however, the major change which was implemented was the right to choose a doctor freely, irrespectively of where you live. Before that, in the old system, still inherited from the Soviet Union, you were entitled to the doctor at the place you were registered officially, or place where you live. Now you can go to whatever doctor you want, either to private facility or to public facility. It doesn't matter.
Private medical institutions are also a part of this reform.
Yes.
So, for example, if I want to sign a contract with a doctor, it could be a doctor who is employed with a private medical facility. Am I right?
Exactly.
Okay.
You can go either to public or to private. And actually, we now see that for the next year, every fifth healthcare provider is private in our healthcare system, willing to provide primary care under this new system, right? So 1,200 providers enrolled for the next year in order to receive funds from the National Health Service according to the new system. So this is the places where you can choose your doctor, and 20% of them are private facilities, which is a kind of tremendous success for the country. We didn't expect it.
How is there any information or any data on how many Ukrainians have already signed the contract with a family doctor?
Yes, and this number is also quite surprising for us. It's 24.5 million people in 9 months, which is overwhelming our expectations. We thought it would be kind of 3 to 4 million of people who would be kind of the first adopters of the new system. However, people reacted very enthusiastically. And by the way, interesting fact that the sociology shows that now 76% trust the family physician. Before that, it was kind of 20-something%. It dramatically changed over only 9 months because we just let people choose the physician they trust.
That's great.
By a very simple step,
How many patients is one doctor allowed to sign a contract with? So he's not overwhelmed with work.
Yep. There is, of course, a standard. By the way, it varies very dramatically across the European continent, for example. But for Ukraine, we chosen the numbers 1,800 per family physician and 900 per pediatrician, because kids need way more attention and time than adults.
All right. According to the Ukraine's Ministry of Health, it has been reported that the state budget for 2019 provided 95.08 billion hryvnias to healthcare, which is 10% more than in the previous year, 2018. How is the money going to be distributed, taking into account that there is healthcare reform going on?
Yes, this is a total budget for a whole bunch of the programs we have. However, if we are talking about provision of health services for primary care, for diagnostics, and for inpatient care, this 10% of raise is in there, right? So this is actually the 10% for the reform exclusively. And most of this money goes to the primary care because we already reformed this system, and the Ministry of Finance now increases the budget. We have this principle that we increase the budget only in the reform system. Now it's more efficient, more patient-oriented. Now we start to increase that, right? And also there is increase for the next stage of the reform, which would be the new principle of financing for diagnostic services.
So this is the second level of the reform?
Yes.
And when is it going to be start to be implemented?
It will start implementation in July 1, so in the mid-year, the same as with primary
this year,
care reform.
2019, 1st of July.
It will be the second level, as we call it, right? The outpatient diagnostic services. Like if you need X-ray, or you need ultrasound, or you need a consultation, or you need a lab test. So this type of care, right? And in 2020, it will be the last stage, and it will be inpatient care, like big hospitals when you need to stay for a long time.
And would you need more finance for, let's say, implementing the third level, because it's the most large scale, if I understand it correctly, it's the most large scale part of the reform, and is going to be financially burdened.
Right.
So.
Yeah, we will definitely need more budget for that.
Okay.
However, we will need it less than a lot of people expect. Because it's not, the problem with our system is not that we lack money, right? It's because it's inefficient. There is a lot of money inside the system in various inefficiencies. I will give you an example of this year. We increased the budget for the primary care reform only 1.5 times in total. However, the salaries of doctors increased sometimes 3 to 4 times because they started to operate in a different way. And also money started to follow the best organization, the best practices, and the best doctors. So the doctor with a good workload started to earn way more. So individual people, individual physicians, they had a very, let's say, tremendous effect on their lifestyle, whereas the whole budget increased only 1.5 times. The same principle will be also true for the next levels of care, where we find leverages on internal efficiencies, aside from just increasing money for the sector.
Does the reform guarantee to Ukrainian citizens the level of proficiency of their doctors that are chosen?
This is something you cannot buy in the supermarket, right?
Exactly.
You need to wait until it grows. But what we want to do now is to implement such a system which motivates this professionalism, right? It's meritocratic system now. Before that, it was like a communist system where everything was equal. Again, example of primary care doctors. You may have 1,800 people, or you may have 100 people in your list. Your salary was equal. It was unfair, and it was not meritocracy because you were not motivated to serve patients better, right? Now it's different. Now when you have many patients, you are popular, your salary increases twofold or threefold. If you have 100 patients, you probably look for another job, right? It's not actually the case in practice, but in principle. The same thing would be the case for the diagnostics, for inpatient, everywhere in the health services. And we believe that with time, it will also endorse and help to grow the professionalism and patient-orientedness of doctors and facilities.
It's no secret that every reform or every beginning has its list of pros and cons. We've heard a lot of pros now. What are the cons of the healthcare reform in Ukraine at this moment?
philosophically, there is very little cons, because what we are doing now is actually our homework we had to do back in 1990s, when most of our neighboring countries completely overhauled the system according to the new principles of their economy, right, the market economy. So we didn't do that homework, and we need to do it now. However, in implementation, of course, there are some drawbacks. And mostly they are connected with, I would call it, inertia of the system, because again, mentality is now rooted quite deeply into the doctors' minds, into the healthcare managers' minds. So they adapted for 25 years for the old system. Now they need to adapt to the new one.
It's going to take at least 3 generations to get used
no,
to.
I don't believe so. I think it will take a couple of years, because people adapt quite quickly. As we saw again in 1990s, when the market economy came, people quickly understood that the rules are different. And maybe in 10 years that our lives changed completely. Now probably it will take the same time to overhaul the health system completely. However, there are some problematic fields, like, you know, some doctors still feel that they need to persuade patients with kind of force, like, you know, they'll threaten them that if you don't, for example, choose me, you will pay for all your services all your life, or, you know, we will not give you vaccines or something. It's still this kind of a communication all over the place.
That sounds like blackmail.
Yeah, yeah, but it is common in the current system, right? So, and you can, as I said, you cannot change it in 9 months. But with time, when doctors will understand that now the money is coming for them with patient, not with your, you know, boss. But there's people who come to you in the front door and ask for help. They will quickly understand that we should focus, you know, to different sources of the income.
Well, hopefully it's going to happen soon enough. Thank you so much for coming.
Thank you.
That was Pavlo Kovtonyuk. He is the Deputy Minister of Health of Ukraine. Thank you so much for watching UATV. Stay tuned for more.